NBME 2026 National Board of Medical Examiners Exam Training Tips. All you need to know. Question 1. The NBME provides the foundation for which major medical exam? USMLE, LSAT, GRE, MCAT. The USMLE Steps 1, 2, and 3 are co-sponsored by the NBME. Question 2. Which NBME self-assessment helps students prepare for Step 1? CBSE, SPSA, CCSE, CSA. The Comprehensive Basic Science Self-Assessment, SPSA, is the standard Step 1 practice test. Question 3. The basic science content usually covers which subject? Organic chemistry, pathology, hospital management, patient billing. Basic sciences include pathology, physiology, anatomy, and pharmacology. Question 4. What is the standard format for NBME shelf exam questions? Fill in the blank. Single best answer, multiple choice, essay, oral interview. Questions are almost exclusively clinical vignettes with one best choice. Question 5. A clinical vignette is a question that starts with a math equation, a patient case presentation, a dictionary definition, a poem. Vignettes describe a patient's symptoms and history. Question 6. Which organization co-sponsors the USMLE with the NBME, AMA, FSMB, AAMC, WHO? The Federation of State Medical Boards, FSMB, is the partner. Question 7. The shelf exam is typically taken before medical school, at the end of a clinical clerkship/rotation, after residency, only by nurses. Shelf exams test knowledge in specific fields like OB/GYN or surgery. Question 8. True or false, NBME exams are transitioning to include more image-based questions. True, false. Radiology, histology, and physical findings are often tested with images. Question 9. What does CCSE stand for? Comprehensive Clinical Science Examination, Common Cardiac Surgery Exam, Certified Clinical System Expert, Complete Care Science Exam. The CCSE is used to gauge readiness for USMLE Step 2 CK. Question 10. The USMLE Step 1 currently uses what scoring system? Numeric, 0 to 300, pass/fail, letter grades, AF, percentile only. Step 1 changed to pass/fail in 2022. Question 11. Which subject is core to the NBME Physiology section? Cardiovascular system, hospital architecture, medical Spanish, computer coding. Organ systems, heart, lung, kidney, etc., are the focus. Question 12. Pharmacology questions often ask about the price of drugs, mechanism of action, MOA, history of the pharmacy, manufacturer's name. Mechanism, side effects, and drug-drug interactions are high yield. Question 13. What is the best way to use NBME self-assessments? Take them once a year. Use them to identify knowledge gaps and predict performance. Memorize the questions. Skip them. They are highly predictive of performance on the actual boards. Question 14. Behavioral science on the NBME includes ethics and biostatistics, world history, physical education, astronomy. Medical ethics and statistics are key components. Question 15. Which step of the USMLE focuses on clinical knowledge? CK. Step 1, Step 2, Step 3, Step 4. Step 2 CK focuses on clinical diagnosis and management. Question 16. How long is a typical NBME shelf exam? 1 hour. Roughly 2 hours and 45 minutes. 8 hours. 15 minutes. They usually consist of 110 questions in a timed block. Question 17. High-yield topics are those that are never tested, are frequently tested and essential for clinical practice, are the easiest to learn, have the longest names. Focusing on high-yield content is a common study strategy. Question 18. If a patient has a resting heart rate of 150 bpm, they have bradycardia, tachycardia, normocardia, no pulse. Tachycardia is a heart rate over 100 bpm. Question 19. An NBME score report provides only a total score, performance feedback by content area, a list of the right answers, a job offer. The report shows strengths and weaknesses across different subjects. Question 20. The physician's task often tested on Step 3 is patient management, medical school admissions, surgical equipment repair, accounting. Step 3 focuses on the independent practice of medicine.